Welcome to Minority Trip Report. MTR is a podcast spotlighting stories of personal transformation and underrepresented leaders in mental health, psychedelics, and consciousness. I'm your host, Raj Siraj. If you're learning from or enjoying Minority Trip Report, please subscribe to MTR on YouTube at Minority Trip Report and follow us on Instagram at Minority Trip. Thank you and enjoy the episode. Today, my guest is Dr. Joseph Zamaria, who is a licensed and board-certified clinical psychologist and an associate clinical professor in the Department of Psychiatry and Behavioral Sciences at the UCSF School of Medicine. At UCSF, he serves as a clinician and researcher in clinical trials, examining the potential of psychedelic-assisted psychotherapy to treat a range of conditions, including racial trauma. Outside of his activities at UCSF, he's a fellow of the American Academy of Clinical Psychology and serves on the advisory board of the Fireside Project. He's also on the faculty of the UC Berkeley Center for the Science of Psychedelics, serving as a lead instructor for psychotherapy and clinical science. Joe, welcome. So glad to have you here.
It's a pleasure to be here. Thank you.
No, the pleasure is all mine. You know, I always fumble calling you Joe because the first time I saw you on Twitter, your name was Joseph Zamaria. And having spent time in the Middle East, I immediately thought, okay, that's probably Syrian. And I was right. You're at least part Syrian. And so I have a hard time calling you Joe because that's a super white way of calling somebody.
Yeah.
Just as I'm ready to Joe, but we'll go with Joe for now. Okay, so you have this unique perspective. The first time we caught up, you said that you sort of integrate these three different streams of thinking or perspectives, which is really special to me, in that you're a psychonaut, you're an experienced psychonaut. You're obviously a person of color, but also you're a practicing clinician. And in my mind, you're not only a practicing clinician, you're pushing the boundaries of what I think the application of psychedelic-assisted psychotherapy could be. And it's very exciting, particularly as a person of color. So I want to start out the interview by just asking you, how did you come to have these three very, I don't want to say distinct, but they are very independent streams in a way in terms of lived experiences. So psychonaut, person of color, which I guess to some degree you can't help it, but also a clinician.
Yeah. And I think there is probably a through line between each of those routes, each of those avenues that feel like an important facet of who I am. I think being a person of color, being a minoritized person, at least in the place that I'm from, that I grew up and so on, I think it leads one to being traumatized, perhaps at times, but also curious. So this can open the door to, for example, a career in a healing profession. It's often, there's this idea of a wounded healer, somebody who has been through their own suffering and then is going back and serving other people. And it's not that I'm just serving people of color. I'm often serving people of color, but I'm serving all kinds of people. But I think probably early painful experiences that I had as a sensitive person, and then on top of that, feeling minoritized and feeling othered, probably encouraged me towards a career in a healing profession. Could be doctor, nurse, acupuncturist, psychologist, chaplain, any sort of profession where you're understanding difficulty that somebody else is going through and trying to empathize with them about that. And then I think to weave in the psychedelic piece too. I don't know if this is true for everybody. Lots of people experience pain. Lots of people are identify as a minority or have been minoritized by the culture that they live in. Maybe not necessarily would seek out psychedelics, but I don't know. I guess I've always been a curious person. And I don't know if now is the time to jump into it, but the first time I ever encountered psychedelics, I was very deeply curious about them. And my curiosity was very much satisfied because it's a very, obviously rich, overwhelming, powerful experience, all the things you could say about psychedelic experience. But I still thought those two avenues were dissociated from each other, being a psychonaut and being a clinician. I got into psychedelics before I got into professional psychology. It was while I was an undergraduate and I was studying psychology, and I wasn't so sure I was going to go into clinical psychology as a profession. But when I started graduate school a few years after, probably 3 years after my first psychedelic trip, I didn't think that those worlds were going to connect at all. And this was the mid-late aughts. So this was like just as kind of the current renaissance of research was just starting to make itself known, where there were these seminal papers coming out of predominantly Johns Hopkins University here in North America, and also NYU, and a few other studies here and there. There was Rick Strassman's work in the 90s with DMT, but what really put the research into psychedelics, the contemporary chapter of research on when I became alert to it, it was those articles coming out in the mid-late aughts. And then I thought, oh, maybe there's a connection here to be made between this path I'm already going down, being a clinician, a researcher, and a therapist, and my passion outside of school, my extracurricular passion for psychedelics. Maybe there's a way for those to weave together. And now looking at how psychedelics can be helpful in treating racial trauma, you'll throw in that third piece too of like, oh, and then it all kind of, it's like a rope that's woven together by all these little strands that's producing a thicker rope. But they all kind of come together. They have come together in my life, I think, as of late.
No, I love it. You made this comment, wounded and curious. I'm curious about how does somebody go from wounded to curious? And we're obviously going to talk about your meaningful psychedelic experience, but I'm that phrasing is interesting to me.
Yeah. I think, well, and I think in some cases they can go hand in hand, because I think to be wounded, I guess I'm self-identifying as being wounded, but I guess I am. But to be wounded, you have to have gone through maybe adversity or stress or trauma or something like that, which a lot of people have. But okay. But I think also, so that's about the lived experience of somebody who's experienced something that's wounding. But I think temperamentally, like by temperament, I mean like the way we're born into the world, basically genetics, basically. That also primes people to be recipients of trauma or not, because like your makeup, your psychological makeup and resilience have something to do with if this is maybe I'm jumping ahead a little bit about what is trauma and how to define trauma, but the same event can happen to two different people. And we wouldn't define it as traumatic based on what the event is, say a bad accident or a crime or something, whatever. We don't define it by the event. We define it by the impact on the individual. So somebody, for whatever reason, they were just more resilient to that event, may not have scarred them in the same way that for someone else who's less resilient. And it's no discredit to that person for being less resilient. I'm saying it like it's a moral failure or something. It's not at all. But the way that it lands for somebody, if they're more sensitive or more receptive to it, it can create a bigger dent, a bigger impact. So I have a pet hypothesis, which is that I'm temperamentally sensitive. I just know that I am, and I'm more emotional and I'm just sensitive, more aware of things, especially in the emotional sphere, than I don't know, maybe an average person I meet who's similar to me or something, who's otherwise similar to me. So I think that also, I think in individuals who are sensitive, they tend to be creative and curious. Really, they make great artists or great scientists, or they really like very sensitive people who aren't just going to steamroll over the details and are really going to pay attention. There's an innate curiosity there that I think goes hand in hand with being very sensitive and then very impacted by traumas. So I think those things kind of go hand in hand there: being wounded and being curious.
Great answer. I think.
One more piece. Can I add one more piece? Just that I think the curiosity too has something to do with a desire to not feel wounded any longer. So probably I probably didn't know this as an undergrad. I probably started to know it as a graduate student, but that studying psychology, it's it's an interesting thing to study. Maybe you can get a job out of it. But I was probably driven more by some desire to try to understand myself and painful experiences I had that were difficult to make sense of with whatever paradigm I had before I was studying psychology.
I love that you added that part, because I completely agree with you. I think, one way to describe sensitivity is also openness, and openness is inherently curious. But yeah, I think this aspect of willingness to change or willingness to integrate, or always looking to integrate information, whether that's emotional information or environmental information, as well as sort of empirical information, is really key here. I think. When you talked about like you never thought your experience as a psychonaut would ever align with your work as a clinician. The place that my mind immediately went to, having spoken to lots of psychiatrists and psychologists, is that, or psychiatrists in particular, is that some of them choose not to do psychedelics because of this, old adage of, hey, it might bias my thinking. And I understand that's a real concern, but the counter evidence to that is that can you really appreciate music as much or can you appreciate music more if you play an instrument? Something like that, maybe that's a weak analogy, but I think I've heard that analogy being made. How do you think about that?
Yeah, it's a really good question. I've heard this come up before too, because there's I don't want to say a debate, but there's an obvious trend in the world of psychedelic research that some people who research psychedelics are very open and out about the fact that they have partaken and that they have used psychedelics, and others are more cagey about it. They're more buttoned up about it, and I don't have any judgments about what people choose to disclose about their history. But the idea that, okay, so if I've used a bunch of psychedelics and I'm a psychedelics enthusiast, and then I research psychedelics, is that going to bias my results? You could make the case, yes, and I could see the results that I want to see. But the same could be true of almost any facet of, let's even just say within psychiatry. Let's just say I was very helped by conventional psychotherapy, and then I want to become a psychotherapy researcher. Am I very biased then because I've been so helped by by conventional psychotherapy or by psychiatric drugs? Let's say a psychiatrist prescribed me an SSRI for depression, and it turned my life around. It really helped me, and then I wanted to go be a researcher, pharmacological researcher. Could I be objective there? Maybe yes and no, I guess. But I don't think there's ever a perfect situation where we're unbiased and we're not people bringing our own allegiance to the research. So it's kind of, if you're really strict and linear about it, it's kind of very frustrating, because you can never just have a
Totally.
totally clean slate. But on the
Totally.
other hand, it's just I enjoy the complexity and the music and the beauty of life, and I think, like, yeah, I guess it's important to look with objectivity about critique of one's work. If I'm really enthusiastic about it and somebody says, well, there's a blind spot here, or you're overstating this or that, I would like to be receptive to that and to try to practice looking at it from different vantage points.
Totally. I think there's this aspect of like, I feel like this kind of thinking, this kind of like uneven judgment placed on psychedelics in particular presupposes that psychedelics alters you fundamentally so that you can't think straight anymore, right? Which is,
Mhm.
it's strange to me. A majority of psychiatrists and psychologists are white, and then if you hear somebody says psychology is racist, and then there's a counter, it's like, no, we're not racist because, oh, look at all the people we're helping. It's sort of like, let's let's sort of pin that notion evenly across all the other biases, right? I'm not saying it is racist, but I'm saying, if you're going to place these soft judgments and assumptions, well, then we have to do it across the board. But even discounting that, what the hell is a peer review process for, if not to counter biases, right?
Totally. Yes.
Right. So I think we can get into that conversation in a bit, but I always think about this sort of tension, and all tension is good ultimately. I like that we're having this debate because we haven't figured out. And science, at the end of the day, I think there's a larger replicability crisis in science, where I think these kind of aspects are coming into play more and more as old research and old data is proving to be completely wrong about the assumptions of human nature and stuff like that. But since you brought it up, maybe this is the right time. Tell me about your experience with psychedelics. Were you born and raised in the Bay Area?
No, I was not. I was born in Detroit, Michigan,
Uh-huh.
and I grew up in, like, suburban Detroit. I moved to New Jersey for college, and I stayed there for a little while, and then I came back to Michigan, and then I moved to the Bay Area in 2008 to start graduate school.
Before we go to that, let's talk a little bit about your parents. You have Syrian heritage. I'm curious about how that thread ties in to your life.
Yeah, yeah. My father is an immigrant from Syria. My mother is originally from Detroit. She's a mixed race woman. She has
Mm.
African and European ancestry. But yeah, yeah. My dad is an immigrant from Syria, and it was when I think about it, actually, it was a little, even more than being part Syrian. What was odd was being bicultural
Mm.
and multiracial. So that actually, like, I have friends who grew up with, two parents who were Syrian immigrants, and there was a little bit. It's not that their life was easy, or
Mm.
integrating into American culture, or themselves being bicultural, because they come from Syrian parents growing up in North America. That I'm not trying to say that that's easy, But there's a simplicity there that that your family of origin is exclusively Syrian.
There's one clean
And
box
for
that you fit
me,
in at least, right?
kinda, yeah, yeah. So for me, it was a little more confusing. My dad did try to help us, like he definitely take on parts of the culture. Like we visited
Mm,
Syria when I was a kid. Definitely food, eating tons of Syrian food, whether my dad made it or
mhm,
grandmother's visiting or something. And the language, he tried to help us with the language. I have a little bit of spoken Arabic. I could never get the script. My brother was a little more talented with that than I.
mhm,
But yeah, I think what it did, going back to the very beginning of our conversation about feeling minoritized and feeling traumatized and feeling like a healer and a psychonaut, it's like, at a very early age, I quite felt like I was other. I grew up in a very white suburb of Detroit, Michigan, called Grosse Pointe, and at the time, at least 80s, 90s, it didn't feel there are a lot of Arabs in Southeast Michigan, but not in Grosse Pointe exactly. And then also they didn't really look like me, those Arab immigrants, or Arab people who were children of immigrants, because of my mixed race heritage. So even amongst a bunch of Arabs, I didn't necessarily fully fit in.
right.
But I think it gave me these first experiences of, like, I felt other, I felt weird and strange and alone and very lonely. And again, all these experiences sort of swirling together through childhood and adolescence, I think bred me to be curious about what is happening in my mind as I'm experiencing these things, and how can I affect these things? How can I influence them or heal them or whatever? And
Mhm,
so my first experiences with understanding myself to be Syrian, probably my very first experiences before our school were pleasant because it was around food and family and stuff. But by the time I was in school, it was probably more about being different and other, and it was more of a painful experience.
yeah, it's interesting. I as well, even though I'm not biracial, and I'm pretty Bangladeshi in the sense that I my both of my parents are Bangladeshi. Having grown up in different parts of the world, I never really fit in any particular culture. Don't certainly don't fit in Bangladesh in the sense that I'm kind of like Western educated in a way, but also in a place like Saudi Arabia. Going to English school in Saudi Arabia that was also made for the lower income kids. So traditionally, when you think of international schools in like Middle East, you're like, oh yeah, well off. I wasn't that. So
Mm,
have this sort of worldview of somebody that's gone to a really good school, but don't really fit in Bangladesh, don't really fit in Saudi, definitely because they make sure you don't fit in there. Um, and then coming to Canada, I feel like I guess I feel more Canadian than I can hold any other identity per se because Canada,
mm,
there's no overwhelming sense of what being Canadian is. Which is its biggest strength in my mind because it's a very big country with very
mhm.
diffuse sort of like, or not many people live here. Whereas in the U.S., I kind of feel like you have to be American first. At least that's my perception as a Canadian. But it's always like, oh, American, and maybe you get to pick something else. I don't know if you share
Uh-huh,
that
uh-huh.
opinion or not, but here it's like kind of. So my point is, I certainly understand what it feels like to tick many boxes, and having this sort of racial, cultural mishmash, very ambiguous identity, until perhaps you learn how to integrate all those little pieces, which kind of brings me to, yeah, psychedelics and how did that start? Because as a person of color, I always find the how you find psychedelics that journey to be really interesting. So I'm curious about your journey.
Yeah. Well, interestingly enough, the first time I ever used psychedelics it was on my 22nd birthday.
Mhm.
I was in Michigan and I was hanging out with my brother who was visiting from Chicago. Interestingly enough, this is an important aside. My brother, who looks and sounds like me, and he was arrested illegally in Chicago because he was running to get on a train. He was trying to catch one of the trains, and he had psilocybin mushrooms in his backpack when they arrested him,
Whoa!
and they confiscated the mushrooms, threw him in jail. No shortage of racial slurs, of course.
Oh my god!
He eventually he hired a lawyer, and they threw it out because they illegally searched and seized without really
Mhm.
due without any cause. So
But
so
the
and it, so that was who that happened obviously after he gave me these mushrooms. But I had been a little curious. I
Mm-hmm.
had a few. I didn't really use a lot of drugs in college. I was an athlete in college, and we were training all the time, and then also we got drug tested. So even using smoking weed or something was rare, and it happened in the off season or
Mm-hmm.
something. People drank alcohol, but that was about it. So I was not really like a big drug user or an experienced psychonaut or anything, but I had a small amount of mushrooms that my brother gave me on my 22nd birthday. And it really piqued my interest. It was enough that I was very interested. And I had some friends in college who were also very curious, also not really drug users.
Mm-hmm.
But one guy found a journal that his parents kept when they were in college and read through it. And they were writing all about their psychedelic trips. And he said, "This is amazing. We have to try this." So I was probably the most. It's funny now because I've gone all in. My half my career is based around psychedelics at this point.
Mm-hmm.
But at the time, I was the most apprehensive. I was saying, "Oh, this I really want to know that this is safe, that we're doing it properly." And we spent a lot of time on Eroid and reading trip reports and trying to figure out how to do it as properly and as safely as possible.
Why were you apprehensive?
But yeah,
Was it
that was
was it
that.
because of like you were an athlete, or because of stigma, or what's the reason?
It was honestly because of, I guess you could call it stigma, but the I'm blanking on the word that you would use for this sort of thing, like the misinformation that has been spread about psychedelics. I'm like, oh, it will scramble my brain and make me like
Mm-hmm.
have hallucinations forever.
Mm-hmm.
Or even the fact that I thought it would make me have hallucinations. I wasn't like there's that could mean depending on the drug, it could mean very different things. Something that's a
Mm-hmm.
genuine deliriant, like datura root, Jimson weed. These things produce. These are deliriant hallucinogens. They can produce really illusions, things that aren't even there.
Mm-hmm.
Like you see something crawling across the window that doesn't even exist. And with psychedelics, it's a very different kind of change to your visual domain. Close your eyes, you get some pretty interesting visions and visuals. But yeah, so I think I just conflated all these sort of drugs together. I thought they were toxic. I
Mm-hmm.
thought there was a point when they could cause death. I thought that they would, literally burn holes in my brain. All of these myths that got spread from the kind of the backlash after the 60s. They infiltrated me. I'm still of the Dare generation, growing up in the 80s with I don't know if you had it in Canada, but the Dare campaign, like Dare to keep your kids off drugs. It was like very Reagan era abstinence around drugs. And so I think I was just influenced by that culture too. And
Mm-hmm.
so my apprehension had something to do with that. I was like, I want to know this is not harming me. And I was anxious about that.
Did you or your brother, either of you, sense that being minorities, you are also going to be disproportionately affected by the war on drugs?
Well, my brother witnessed that firsthand,
Yeah.
and I think he was indeed profiled just because of his
Mm-hmm.
appearance. I think my own relationship to my raciality has morphed over time. And I think at that time that I first started using psychedelics, I was a little bit more dissociated from my racial identity.
Mm-hmm.
I wasn't at all in conversation with the parts of me that have African ancestry.
Mm-hmm.
And I tried to minimize the parts of me that had Caucasian ancestry. And I hid behind things like, I don't know how this is in Canada. It's changing actually in the United States, but for the longest time, if you're Middle Eastern, North African, you're considered by the census, you're considered Caucasian, you're considered white, even though you look
Oh,
different and you're
really?
treated differently and stuff.
Really?
We're lumped. If you see it like the federal census in the United States, it will lump if you're Afghan or Iranian or Arab or Tunisian or whatever, you'll be Caucasian.
Is it because Jesus is
Um,
white?
but Jesus had blue eyes and blonde hair, so he wasn't our kind of white.
Of course,
If you
of
look
course,
at the
for sure.
pictures, all those famous paintings of him, he
Of course,
looks
the picture
very,
doesn't lie, right?
very,
Church doesn't lie,
yeah,
definitely.
he's very Germanic, very Germanic features. Yeah, but yeah. So I think at that time I was dissociated from my own racial identity. So I don't think I was thoughtful about how it would be different for me.
Mm-hmm.
I've had enough conversations with people of color over the years and the various apprehensions they have about different sectors of the psychedelic world that feel either dangerous or exclusionary. And it makes a lot more sense to me. But just at the time in my early 20s, I wasn't thoughtful about that.
Mm-hmm. Mm-hmm. Yeah, it's interesting how our sense of selves, and even for me, like I had denied, depending on where I was, because all these identity heads were so politicized, and it wasn't so much racial. It was, hey, don't tell people how poor of a background you come from. Oh, hey, don't tell people you're Bangladeshi by citizenship because nobody understands where Bangladesh is from. It's considered to be poor, destitute, blah 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 blah. Or leaving and coming to North America right after 9/11. Don't say you're Muslim. Don't say you're Muslim, right? Stuff like that. I mean, I had my own problem with religion, but that's on the side. I don't have any issues saying it out loud and proudly right now, but back then,
Yeah.
definitely trying to hide it, suppress it, make sure you're seen as Western as possible in both in your value sets and your outlook and perhaps even the way you dress and stuff like that. So,
Mm-hmm.
what would you say psychedelics and repeated psychedelic use after? What do you think it brought to your life, both in terms of the person you are today and the work you do? What sort of integration and sort of what sort of value sets did it bring to you?
Yeah, yeah. So after that first psychedelic trip with my brother on my 22nd birthday, I used a lot of psychedelics in my 20s and 30s, and it corresponded with well, I'll zoom out and say that when I was in college around the time, and I was using psychedelics towards the end of my time in college. I was a double major. I was psych and philosophy, and I always thought I was going to go to law school. And there was a little bit of that thread in my family. Wasn't so stark as I've heard in other families, but reminiscent of what I hear from my friends who come from Asian immigrants or maybe Middle Eastern immigrants of like, let's be a doctor, lawyer, engineer.
Mhm.
And I didn't have the acumen, I think, to be an engineer, and I wasn't sure about becoming a physician either. But I had heard from a very early age I was a very loquacious person and a very argumentative person. So I was told you should be a lawyer. So I just assumed I was going to be a lawyer. I enjoyed studying philosophy in undergrad, and a lot of philosophy majors go to law school because it's the basis is logic and critical thinking, creating an argument, and so
Mhm.
on. So it's kind of intuitive for if you're a philosophy major, there's not a whole lot. There's maybe not many jobs that
Mhm.
will look kindly upon that degree, in spite of the fact that I think it's a useful degree. But you can go get a PhD in philosophy or you can go to law school. So
Mhm.
I was on this track to go to law school. And I remember I was spending time with lawyers and getting ready to apply, and just the more I understood about the legal field, the less I think it was a direct result of all the psychedelics I was using, but it made less sense to me. It wasn't, and enough, no disregard to the legal field. I think it's a great, honorable, fine, necessary profession. It was just
Mhm.
I started to see clearly that it wasn't congruent with my person. That became as I started using more psychedelics. That became more clear, and I said, well, what the hell else can I do? I have a double major, psychology, philosophy. I guess I could study psychology. And then I started spending more time with psychologists and looking into graduate school in psychology. And that felt very congruent with the changes that were occurring in my mind then, somewhat due to psychedelics use. So I felt like my mind was growing, and psychology was a paradigm with which I could understand my mind and how it was growing. And then, continuing to use psychedelics heavily through graduate school. I mean, heavily is relative, but and I was always using them, I think safely and wisely and thoughtfully. But I had a lot of psychedelic experiences while I was in grad school, and it sort of synergized with what I was learning in school and how I was understanding human behavior and the human mind and things like trauma, clinical phenomenon like phenomena like trauma that I was starting to see. It started to coalesce together, and it started to make more sense, especially when then I could actually apply my career to psychedelics and formally study psychedelics. And then, yeah, I think it's along with that, I spent when I was in graduate school, I don't know if it's this way anymore to get a doctorate in psychology, but when I was in school, my program required you had to get at least 1 year of personal therapy, weekly personal therapy.
Mhm.
You couldn't get your doctorate if you didn't fulfill that standard. I think it's an extremely good standard. I think some programs
That's
now
really
encourage
interesting.
it but don't
Wow.
require it.
Wow. Okay.
Yeah, yeah. And I think the idea is like, how could I possibly be of utility to a patient if I haven't been in their shoes, been on the been on the other chair, been in the patient's chair, and know how kind of vulnerable and scary going to therapy can be. And also, you work out your own. I have issues. I have blind spots and stuff that also can cloud my clinical judgment. So working through that can be really helpful. And then it's a great way to learn too, because you see an expert hopefully if you hire somebody who's good, you see somebody who's proficient in practice, and you say, oh, and when they did that thing, it really didn't work for me. When they did this thing, it really worked. So I think it's a great standard to have psychology grad students required to attend therapy. But that, I went well beyond 1 year of therapy. I spent many, many years in therapy. I recently started it with a new therapist about a little less than a year ago, who practices a type of therapy called internal family systems therapy. It's excellent therapy for healing from trauma. It coalesces really nicely with psychedelic therapy. A lot of psychedelic therapists are very interested in IFS therapy, but basically, Rod, what I'm getting at is like a lot of psychedelics use and a lot of therapy. It was just like excavating all this stuff from my mind and allowing me to become more intimate with my mind and my quirks and my history and intergenerational trauma and my relationships and my typical defensive patterns and things. It just allowed me to become a lot more intimate with myself, which is what I think a lot of people say when they use psychedelics. But on top of that, synergizing with going to regular therapy and formally studying psychology, I felt like the effect was very powerful.
So what I'm hearing is, I think psychedelics allowed you to not only have an acute awareness of, let's just say, your inner world, but also allowed you to synthesize this person that you are by calling in and stitching together all the different parts. Because ultimately, I feel, and this is not necessarily just psychedelics, but I think any sort of contemplative practice, whether it's meditation, whether it's dance, or whatever you want to call it, allows you through long term to not only recognize the conflict inwards and all the tensions of different parts of you, but also to hold them without judgment. And it's the suppression and the tension that is unresolved is what causes issues, I think, long term with most people.
I think that's so absolutely true. I'm surprised you are not a psychologist or not a therapist, because
I certainly don't have drugs to become one.
Really,
yeah. No.
It's I think that's so true, and I think there's a principle there which is really beautiful, which carries on to larger spheres of humanity. So basically, yeah, if I think some part of myself is shitty and I want to throw it in a compartment, stuff it in the basement, stuff in the closet, stuff in the attic, I'm not integrated. I'm not a whole person, and I'm operating. Think how much effort I'm applying to dissociate that part of myself from me. And then I'm also not a complete person showing up for you. I have to figure out, what is that part of me? Is that part very angry? Well, I need to figure out what that part's angry about,
Right.
Or is that part really grief stricken? Am I just always sad and depressed? And I try to shut that part out and try to act happy and stuff. It's like, no, I need to go address what's the painful thing there. So integrating, just like you're saying, bringing together all the disparate parts, I think is one of the definitions of psychological health. And I think that's true on, concentric circles outward through humanity, within a family, within a community, within a nationalistic government or some other larger community structure. It's like when I hear that, some countries don't talk to other countries. Oh, we don't negotiate with them or something. I understand. I'm not trying to delve into, I'm sociopolitics is not my expertise, but it does seem troubling to me as a human being to see some humans say we are not going to talk to those other humans. I think it breeds kind of extremism. And so if a group of people aren't being addressed by a majority group, they're going to say, okay, screw that. We're going to do something more extreme here. We're going to do something scarier here. I think our minds can do that too. If I say, I don't like to feel angry, I don't like to feel rageful, I'm going to chain it up like a dog and put it in the crate in my basement, I think it's going to create some problems down there too. Just like a dissociated faction of humanity is going to create problems if they don't feel a sense of belonging.
That's such an interesting way of putting it. I actually never thought of it that way. Like, lack of integration or inner suppression causes extremism between different parts of you. That's a really interesting way of putting it. I'm going to switch gears a little bit because I do want to spend and give attention to the time it deserves to this sort of your work, which I think does cover a lot of what you said already. And as I mentioned in your intro, I think it's also pushing the edge of where psychedelic therapy can go and for who and in what way. How do we build a more compassionate, caring system and models of care, particularly for people who have been historically marginalized and continue to be marginalized? But before we get into that, I think it's really important to define, at least from your perspective, what certain terms mean. And in the world of mental health, partly because my belief is partly because it's such a gray area, and even you add psychedelics to it, there's lack of standards. There's like who is equipped to be a psychedelic therapist or even a trip sitter and so on. A lot of words like trauma, PTSD get thrown around, and I'm not trying to minimize anybody's pain, but I think at least in the clinical realm, we should define what they mean. So before we talk about the world of psychiatry and psychedelics and psychotherapy for racial trauma, let's talk about first of all, what is PTSD? Tell us also what the DSM is. I think that's really interesting. And then tell us a little bit what Monica Williams, who is renowned in this field and who you work with very closely. I pulled this from one of the articles you shared with me. Is that she said the history of psychology and psychiatry is racist. Tell us a little bit about why she said that, and why that is true. So I know it's a lot; it's a loaded question, but definition of terms, and then why is psychiatry, psychology racist?
Sure, sure. I guess what I will talk about first is what I think trauma is, and then I'll talk about what I think PTSD is, and then we can get to the fields of psychiatry and psychology. So trauma, think about it when we're describing our physical bodies. This is in San Francisco, our general hospital, San Francisco General Hospital, is a level 1 trauma hospital. So that means they can feel the worst of the worst, gunshot wounds and things like that. But trauma, it refers to a wounding, a breaking apart of something. If I cut my hand with a knife while I'm chopping vegetables or something, I've somewhat traumatized my hand. There's a break there. There's a breakdown of the integrity of my hand, right? Where the cut is. So I think the same concept can be true psychologically, where there is an insult or injury that creates some kind of disintegration of the normal makeup, the makeup of the person's mind prior to that occasion. And so trauma was first, I think there have been, since time immemorial, people have found ways to poetically and maybe clinically describe trauma. I'm just going to talk about it within 20th century North America, let's say. After World War I, which was like, at the time, it was just the most ghastly war that could have possibly been. People were, the people who fought in that war were used to an era of wearing big bright things and going off to war and having an adventure and riding a horse. Not that war in the 18th century, 17th century, 16th was pretty. I'm sure it was hell also, but I think World War I was so dark and ghastly. They were using chemical weapons and fighting in trenches, and there was untold slaughter. People were returning home from that combat really messed up. They were really messed up. And they, at the time, they called it shell shock. And so what it probably looked like was some syndrome of being depressed or shut down or emotionally reactive or abusive or addicted to alcohol or things of that sort. And so our understanding, you'd go from, and that's by no means the beginning of the conversation, but it's a beginning that I choose to start in, is like World War I and shell shock through World War II. And they started talking about battle fatigue, but same idea. Some people going through really harrowing wartime experiences and coming back not the same. So you see that thread of trauma is existing here. Something's happening and they're not the same. And then I think by the Vietnam War, maybe the Korean War, I think it was post-Vietnam War, there's actually a colleague at UCSF who coined PTSD and helped it to be added to the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. It's currently in its 5th edition. This is a document that's produced by the American Psychiatric Association. It's sort of a library, sort of a lexicon of disorders, of types of psychiatric distress that people can experience. I think some people find this document somewhat helpful. I think most people find it somewhat limited.
What do they call it?
I think it's helpful.
Statistical manual. That's the part I always like.
Yeah, because it discusses the statistics involved with each of the disorders. So we'll say, when so each defined disorder within the manual, purportedly they've done a lot of research on to determine, is this a true syndrome, and how prevalent is it, and how does it respond to treatment? So these are the statistics. 1 out of 100 people have OCD or whatever. That's a statistic. So it gives you the statistics of the disorder in addition to the descriptive, phenomena of the disorder. So, I think psychiatrists use it more than other mental health professionals, but other mental health professionals use it too. It's somewhat helpful for communicating to insurance companies that you're treating this particular condition, which has a code associated with it. I think clinically it's quite limited, especially as a psychotherapist or a psychologist. There's so much more deep, full ways of understanding human behavior and human functioning besides the DSM. But going back to our understanding of trauma, it was largely understood through the eyes of a person who was engaged in warfare, a veteran. That was how we in our culture understood trauma. Certainly, though, that person who comes back from war, who's traumatized, if they abuse their wife or their kids, that's trauma too. But that was identified as trauma later. The foot in the door was understanding warriors' experience. And later we realized that you don't have to be in a war zone to have experienced trauma. So over time, the definition of trauma kind of morphs and changes. Let me briefly define trauma and then just talk about what is the cultural baggage along with the PTSD diagnosis. So when in my field, we talk about 2 different qualities of trauma, 2 different types of trauma. We would say capital T trauma, lowercase t trauma is kind of a cute way to talk about it. But capital T trauma would be a singular, overwhelming, intense, perhaps life-threatening event that affects somebody. You were driving in a car, you crashed the car, you barely survive. That's a big T trauma. Especially if life was normal up until that point, and you had this bad accident, then that's a big T trauma. You go to a war zone, and then you engage in combat, and you get wounded, or you wound somebody, or kill somebody, or you see a friend get wounded or killed. That's capital T trauma. Singular index event. Could be a crime, could be whatever. And so when the DSM is talking about PTSD, that's what it's talking about. It's talking about a syndrome that follows after a singular index trauma like that. And there's very tight criteria about how those index trauma are defined. For example, it cannot be through media exposure. If I'm 5 and I watch a whole bunch of very violent movies and it traumatizes me, that cannot count as PTSD because the prerequisites to meet the diagnosis of PTSD don't account for that kind of secondhand media experience. It has to be firsthand or maybe secondhand through some a close loved one who was almost killed or something like that. So this has relevance to minoritized people because every time a Black person is killed and they show it on repeat 24/7, there's not so just look at that there's not a place for that to land in the psychiatric lexicon. Somebody who's Black who's viewing that could say, I'm fucked up from this. And a psychiatrist will say, well, you weren't there in person, so I can't give you a diagnosis of PTSD. I don't think an average psychiatrist would be that callous about it, but still look at the system that's in place. It cannot read that experience that somebody who is minoritized may be having because of its own limitations. So,
and then even if they did give you the diagnosis, try getting insurance or coverage and stuff like that after, right? That's also another problem.
Exactly. You'd have to fudge something or fabricate something just so that a person, and I'm sure lots of ethical clinicians do that just to make sure that their patient can get treatment. But yeah, just the fact that there has to be a loophole is evidence that minoritized experience isn't central. It's not part of the standard, So that's big T trauma, a singular traumatic event. There's also lowercase t trauma, and we also would refer to this as complex trauma, but this would mean repeated trauma of varying degrees. It could be very intense or very not intense. Somebody who comes from a household and let's say they were physically abused every day or sexually abused every day. That's so important, but it could be happening. It could be a daily occurrence, not a one-time occurrence. Or much more subtly, domineering or withholding or slightly neglectful parents. It's not going to create the same kind of impact as like childhood sexual abuse, but it's still going to have an impact if your parents never said "I love you" or your mom didn't pick you up when you cried or whatever, like things like that over time and time and time again. It's going to affect. Remember, we're talking about trauma as something that irreparably, I don't want to say irreparably, but decisively changes the makeup of a person. So you can think of a capital T trauma as like a single blow that severs something. And lowercase t trauma is like abrasion, like wear and tear over time that eventually set. But the severing is what is important here, right? So PTSD is just a thin slice of how we could understand trauma. And people who have been through trauma may not have PTSD, but they may have any other number of psychiatric diagnoses like dissociative disorders or depression or substance use disorders. Can affect people in other ways besides PTSD.
And one of the other things that in my understanding, is the definition of PTSD or depression or things like that, or anxiety, perhaps. I'm not sure about anxiety, but I've definitely heard about depression and PTSD, is that when your social relationships become dysfunctional as well, right? So your relationship to others are impacted by the sort of inner chaos caused by, whether it's a accumulation of, so small t traumas or a big T trauma.
Exactly. Yeah. And I think that's true of I think it's true of anxiety. I think it's true of any psychiatric disorder, that if there's so much turmoil in my own mind, it is going to affect my other relationships and how I relate to other people. Using PTSD as an example, imagine a veteran who's come back from war. PTSD is characterized by either syndromes of hypoarousal or hyperarousal. Hypo being, not enough arousal, hyper being too much arousal. So you can think of like arousal, like our general level of stimulation and awareness and so on. There's a sweet spot in the middle that we want to be in. If I'm hyper aroused, that's like the traumatized person, the veteran, whomever, who is very emotional and reactive and jumpy. And maybe in the movies, you tap them on the shoulder and they throw you over their shoulder. Like that's hyper aroused. But you also see people who have a syndrome of PTSD who are hypo aroused. They're kind of depressed, numb, shut down, not really, you might see a movie about somebody who's been in a war and they have the 1,000-foot stare in their face and they can't really muster up much feeling. And they just, maybe they numb by using alcohol to kind of filter out experience, to kind of drown out experience. So both of these syndromes are possible with PTSD, and you can imagine how that would affect a relationship. Imagine a dad is so emotional and checked out, he's just in front of the TV drinking beer and he can't say anything about how he feels. How's that going to affect the family system?
Right.
Or a parent who is jumpy and overreactive and emotional and always on edge. How's that going to affect the family system, their partner, or their children, whomever?
Absolutely. I'm cognizant that we don't have a whole lot of time left, and there's so much to talk about. This is such a meaty topic to get into. I want to perhaps spend the rest of the time talking about the work you're doing. And I think you're working with some of the best minds in this space about how do you understand racial trauma, but also where does psychedelics come in? Before we talk about the application of psychedelics and designing perhaps better clinical trials or having better models of care, tell me a little bit about how do you actually diagnose or measure or quantify what racial trauma is? What are the tools that we're developing, knowing that the DSM has been lacking?
Yeah, it's a great question. And I think there is probably a split amongst clinicians about what sorts of methods they use. I'm talking mainly about clinical psychologists, psychotherapists, maybe psychiatrists. What sort of methods are they using to diagnose their patients? Some people swear by paper and pencil questionnaires that have some sort of empirical validity and give you some sort of standardized score that says, well, and this is often what's used in clinical research. Like for PTSD, there's the CAPS. It's the clinician administered PTSD scale. CAPS is what it stands for. And so that gives you a standardized number. It gives you a rough idea of like how acute somebody's PTSD symptoms are. And of course, where this is tricky though, is you could be a 75 out of 100. I could be a 75 out of 100, but you may be very hypo aroused and I may be very hyper aroused. So the way we look to other people could be very different. So there's a way that a standardized score kind of flattens out individual difference. but on the other hand, it does give you kind of a shorthand of like, okay, 75 out of 100, that's pretty severe PTSD. You know, for racial trauma, okay, sorry, actually, so there's other clinicians who maybe look more subjectively about what their patients are telling them.
Mm.
If their patients are saying it's too hard to live, I can't go on like this, I keep having nightmares about the thing, that's another way of gleaning information. And if those things change over the course of treatment, we can have a good sense that therapy is working. Like oftentimes I'll see patients for PTSD in my practice, or complex trauma or other manifestations of trauma, and things like panic attacks and nightmares and things will start to stop. They'll start to go away. They're still troubled by their events that occurred to them, but there's other I'm not necessarily giving them a piece of paper and saying, how many panic attacks did you have this week? How many panics? I'm not necessarily doing it in a numerical, statistical way. So there's a difference there. With racial trauma, there are scales that have been or are being developed to help clinicians if they want one of those quantitative scales. In fact, Monica Williams and colleagues developed something I think it's called the racial trauma scale.
Mm-hmm.
And so that can be used by a clinician. I don't know much about the scale. I don't know if it's self-administered or the clinician interviews the patient and fills it out, or, there's different ways that these sort of things can be done. But I'm aware of the racial trauma scale that Williams and colleagues developed. Things that I would be looking at is the narrative that my patient is bringing to me. And like, if they're if they are somebody who is minoritized, whether or not they're a person of color, but certainly if they're a person of color, I'm listening for how their experience has been in this country, in this continent. I'm listening to what they're telling me, and also what maybe they're not really telling me, but maybe showing me about their experiences of being a racialized person. And I'm trying to connect the dots about, like, through asking them questions about, like, did this event that occurred to you, or did being the only brown person in a white place or whatever, how did that affect you? How did that shape you? And then we might sort of track changes together as they become more integrated. Earlier today we were talking about being integrated. So, treatment for racial trauma, what it can't do is stop racism. Like, that's just going to keep happening until we become more enlightened somehow. But what it can do is it can prevent somebody from internalizing all this toxic messaging about being a racialized person. So if somebody's the only brown person in a white space and everybody says you're weird, you're brown, you're ugly, you're bad, somebody can, especially a kid, they can internalize that and they can say, well, I'm weird, I'm ugly, I'm brown, I'm bad. This is just who I am. And that creates syndromes. That creates addiction and depression and trouble with relationships and emotional dysregulation. So the goal of treating racial trauma would be to help somebody not necessarily internalize those things, be able to recognize that toxicity is being spewed at you, but you don't have to swallow it as much. You don't have to be unconscious to swallow it.
So it makes you resilient.
Say, wait a
second.
second.
Like by giving you self-awareness and regulation, emotional regulation.
I think that's right. Yeah, I think that's right. So anyway, so in short, I wouldn't necessarily want to use the racial trauma scale to assess for trauma. Some clinicians would. I would go off of how they're talking to me when we start treatment together, and how we develop collaboratively our treatment goals, and how they look over time. How are they becoming more whole, more integrated, more at peace, at least internally, even though the external world can be certainly very tumultuous.
So where do psychedelics fit in here? Is there a particular application of psychedelic-assisted psychotherapy here? Or are we saying that, look, psychedelics generally can help anyone with PTSD. We just haven't looked at, administering it to people of color or racialized people?
Yeah, I think different psychedelics can help differently with treating trauma. MDMA is a psychedelic, which, at least in the United States, it's on the cusp of FDA approval. We keep hearing, it's going to be next year, but I really do think it'll probably be sometime in 2024. Don't quote me on that though. But MDMA, I think, is understood in psychotherapeutic and psychiatric spheres as being the frontline medication to help with trauma. But I think things like ketamine and classic psychedelics like psilocybin could be helpful too. I think the VA is now interested in looking at psilocybin to treat trauma in addition to MDMA. So each drug helps a little differently. So yes, I think generally they're helpful for healing and for trauma. And I think for racial trauma, if you look at, I think it's since the 90s, since the current era of psychedelic research, started back up, something like over 80%, maybe even 90% of participants in clinical trials of psychedelics have been white, which is not representative of the population in the United States. So it's like there's a lot of reasons why people of color may not participate in research like this. There may be cultural baggage around it. There may be cultural suspicion around engaging in medical research, especially given the sins of medical research that have occurred within our country against minoritized people, against people of color. So there's a lot of complicated reasons why somebody might not just sign up for a study for psychedelic-assisted therapy. Other reasons may be economic. I know it's not a one-to-one comparison that being a person of color means that you're economically disenfranchised, and being a person who's white means you're not and we know that's not true, but economic hardship disproportionately affects people of color. And if you're getting paid $50 a day to come in and spend all day in a clinic to get tested, and and you work a shift job or you work an hourly job, and you don't have vacation, you don't have sick, that's a much harder. If you have a cushy job, you can take a vacation day, or it doesn't really matter. You don't even have to take a day off. You can. It's much easier to go in and say, yeah, sure, I'll take $50 to take some mushrooms. So there's barriers preventing people of color from getting into the. But some research by Monica Williams and others has looked at, it's like survey-based research, asking people of color, have you used psychedelics? And what do you think of it? And they do seem to be very helpful for people of color in the ways that they're helpful for non-people of color, but also in terms of concretizing, sort of crystallizing a racial identity. And it certainly happened to me, but I think it's been shown to be the case by Williams in at least one of her papers and colleagues, that psychedelic use for people of color can be helpful in all the ways that it normally is helpful. It can be helpful in the development and establishment of a strong racial identity, and it can be helpful after a racial or an instance of racism. Somebody has experienced some acute racism and then has used psychedelic, at least in the research that I'm thinking of that Williams has done. They're saying this was helpful. It helped me process or work through it, or kind of get it out of my system or something, So I think there's unique possibilities with people of color and psychedelics.
Great segue to my last question, because we only have a few minutes left. Joe, I'm wondering, you as I consider you as a leader in this particular application and field, what questions should psychiatry be pondering considering the MDMA? And I share this opinion with you in that I do expect it to be legalized somewhere in 2024. What questions, what sort of potential is there? What possibilities are there with these tools, and knowing the increasing awareness of mental disorders, particularly in marginalized communities? What are these sort of questions we should be pursuing?
So the other questions we should be pursuing are how are we didn't get to the question about like psychiatry and psychology being kind of inherently racist, but maybe we can touch on it. But that, like, how are our systems failing minoritized people? So how is conventional psychiatry or conventional psychotherapy failing people of color? And then we can go back to this question of why are people of color not signing up for psychedelic studies? And it's like, well, the research team is like mostly white, and the rooms are decorated in this very either new age or sterile sort of way, and it's not congruent with their culture. And, maybe the maybe the clinical team is white or isn't properly representative of the communities that they're trying to treat, and so on. And so I have a bigger question, which is, how can we create a clinic or a research study that meets the needs of people who are not their needs are not normally met by conventional academic medicine? So, like, and there are some racial trauma clinics popping up around the United States. And for example, they staff, if they're treating the Black community in their neighborhood or in the city, they're staffed by Black clinicians and they're run by Black managers and supervisors and stuff. So it's like it's representative of who they're trying to work with. And so I think at a minimum, if if an academic center were to be interested in launching a trial to treat racial trauma with psychedelics, I would very much I would think it would be necessary for the clinical team to be representative of that culture that they're trying to of that community that they're trying to treat. And I would hope also leadership, like the investigator running the study or the clinic director or the medical director, whomever, is also representative of that culture. Because I think there's intangible ways that will create, tangible and intangible ways where that will create more safety and allow participants to be a little more interested in engaging in research like that.
Fantastic. This has been extremely educational. Joe, thank you so much for spending the time with us. There's so much more to talk about, but unfortunately the podcast, only allows for so much time. It's been wonderful. From getting to randomly connect with you on Twitter to now this, I'm excited to follow along and all the work you're doing. Congratulations. I think the work you're doing is so important, and it's part of an ongoing emerging conversation that, again, excited to follow along.
I'm super happy to be here. Glad to meet you. I think what you're doing with the podcast is great work. I think what you're doing generally is great work, but I'm really excited about the podcast, and it's been an honor to be here.
Thanks,
with
Joe.
you
I really appreciate that. This podcast was brought to life with the help of Carolyn Tripp on art and design. Thanks so much for listening to Minority Trip Report. If you're learning from or enjoying the podcast, please subscribe to MTR on YouTube at Minority Trip Report and follow us on Instagram at Minority Trip. It's a zero-cost way to support us and help us spread the word. Please also sign up with your email for new episode announcements, events, as well as our forthcoming newsletter. I'm your host, Raj Suraj. See you next time.